Welcome back to another amazing episode of Medshield Movement Connect Show with me, Dr. Fez. Now, we're speaking mental health awareness this time around. And we've talked about depression, anxiety, but we're going to get into something that's unfortunately uncomfortable, but we're hoping at the end of it, we're going to be a lot more loose, a lot lighter when it comes to speaking about grief with clinical psychologist, Dr. Portia Mazabane. Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect Show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Fez Mkhize, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect Show. Let's go. Thank you so much for sitting down with us, Portia.
Thank you for having me.
Now, we're talking about the fact that it is mental health awareness kind of this month, and today we're just really getting into some topics that aren't spoken about within the mental health space, because everybody always talks about anxiety and depression, but grief is something that hits us quite hard and might not get as much of that spotlight. Could you tell me from your perspective how you define grief?
Okay. Grief can be defined as an emotional reaction to a loss. So grief normally happens when someone has lost either someone that they've been close to or something that has been taken away, or they have lost it. Actually, I think I read somewhere some time ago that grief is actually a word, the original word for grief. It's in Greek, if I'm not mistaken, meaning that something is taken off suddenly. It's not something that is planned. It's not something that is preempted. It just happens. That's why a number of times when someone is going through grief, we have this intense emotional experience that is normally very painful, and we never get to accept. Yes, we do accept eventually, but it's really difficult for a number of people to reach that level.
I think that's why it's such I mean, I love the way you're defining it, but that's why it's such an important thing to get into, because it is just sudden. It's like I was going this way, and then all of a sudden, the whole landscape of my life changes. And I think that's why, as a talking point, it's interesting, because I know there are phases to it, and there's ways that you almost have to adapt and come to terms with whatever it is that has been lost. And most people at home, as would see, like there's point of, okay, this phase, this phase, this phase. If you had to define it per, I don't even know if you're going to go DSM 4-5, but per kind of a clinical idea, how would you then start telling someone they're going to be going through which phases?
Yeah. The person who came up with the phases, or some call it stages of grief, is Kubler-Ross. And I think when she defined those phases, it is based on your observation. Now, in terms of defining these phases of grief, there's no one that will come to you, and it differs because as human beings, we're different in terms of our personality, in terms of our upbringing, our belief, our faith, which plays a huge role in how we grieve. So I can start with saying denial. You know, you hear that something happened to this person, you've just lost this person. A lot of a person gets into a state of shock that they deny that, no, it can't be. You know, because your mind, when you are in denial, in a way, your mind is trying to protect you from
it's like a
disintegrating. It's like that phase that comes just like that. And from there, others, they would go through the phase of bargaining. You know, they either bargain with God if they believe in God, or they either that maybe the person is, you know, it should have been. But the other phase is anger. A lot of us, when we are grieving, we go through anger, because at times when we are angry, the person would be angry. If the person was hospitalized, would be angry with either the doctors, the nurses, the institution. Others would be angry at God, which it is their right to do so, or angry at others, like, no, the husband, if the person was married, the husband treated her badly, that's why she died. Even if the terms are not, or the facts are not interconnected, they would blame because of anger. But also, then there's that phase of acceptance, you know. And when a person accepts, that's when they are saying, you know what, yeah, it's okay, they are in a better place, this is what happened. But even before that, there's that sense of depression Remember, whether a person is shocked, whether a person is angry, whether there's that thread of depression which they feel intensely. It's not like just a normal sadness, because depression is not merely sadness. It goes deeper, where a person feels intense pain, they feel hurt, they are crying most of the time, they feel hopeless, all the symptoms of depression. A person who experiences grief does experience it.
And it's a journey, and I love what you were saying, that it's not that it's, okay, this, and then, because that's what most people think. It's, okay, now you're in this phase. It's okay, in about 2 days you'll transition.
Yes.
And that's also what I wanted to ask you, within your practice, within seeing people and seeing these rolled out in real world. Do you find that some people move through quickly? Is there a time frame where you go, okay, it's going to take you a month or 2 months, and if someone's died, maybe it takes 3 months? Or do you just have to work with it per each person?
You know, the process of grief is quite tricky.
Yeah.
I'll make an example. Say someone loses someone through death, like right now. The reality is they know, especially because of different cultures, different beliefs, we grieve differently, right? They would know that we need to arrange funeral, we need to do 1, 2, 3. So they get still in denial. They get into the stream of, having to meet those rituals that we do, or whatever that we do, to say the funeral has to happen. And even after, there are instances where someone is working, the following day they are reporting to work after funeral. In a way, they are going through denial. And others, by the way, I've seen people that have been grieving after 2 years, they come to me that the reality has just hit. I've been going through 1, 2, 3. Now, when coming to grief, I normally tell people that a person, we don't really get out of grief.
Yeah.
Because in my mind, when I think of grief, I say, imagine a piece of a puzzle that is complete. That's your children, your family, your wife, your husband, your what, and that's the loved one that you have lost. Imagine now you are removing that piece of a puzzle. In other words, you learn to live with an incomplete piece of puzzle. Sure. There'll be times when it will be hard for you to move on, but there'll be times when you say, it's okay, we're doing it. Doesn't mean you are forgetting the person or you have healed totally. No, it doesn't mean, because that space will forever be there. That's your new normal. So we learn to live around it. Hence, you'd hear a lot of people say, you really don't get through totally out of your grief. Yeah.
Which is interesting for me, because I almost imagine when you go acceptance, which is the thing people go, okay, there's acceptance.
Yes.
It's almost like sometimes people think that it's just like, okay, now you're done. And then you carry on with life as you were before the grief period. But it's right, it's that shifting and realizing that life isn't the same. And so for you, when would you say somebody is within a space of acceptance, and how would that look? Is it that they are back working? Is it that they don't think about those thoughts anymore? How would you maybe define roughly how somebody would be in a point of acceptance?
I think for me, a person would have reached acceptance when, even though they think about the person, there's a sense of peace. Normally, when I see someone who has been grieving, like from A up to Z, the person at some point would say, I'm at peace. I can't explain it. I had a lot of whys. I was angry, but I've got a sense of peace. The shift, you see it when a person is grieving, and when they think about the person, they will tear a lot, they will cry a lot, they will be angry. But when they have shifted, even when they cry, it's no longer that intense crying with desperation and fear and anxiety. It's that crying of, oh, I'm thinking of so and so. He or she would be saying this and this, and there's a smile. Not a smile because they are happy, but a smile of a sense of peace.
Sure.
Yeah.
There's beauty even in kind of this idea of you can lose things, and because life's unpredictable, and I tell people all the time, things can happen to you like this. And for me, from a personal standpoint, my interaction with grief is that from a young age, I lost my father. I didn't really know him. I was about 2.5 years. But recently, because now you talk about depending on what you believe in, depending on your culture, depending, I even feel on age and how you can contextualize things, you tend to enter it with a different mindset. Just lost my aunt not too long ago. She passed. It was breast cancer, so at least there was a period of understanding what was going to happen. So it was a loss, but it was a loss that would kind of be predictable. And just the very year before that, I'd lost a cousin who we hadn't expected. And it hits differently because I guess you go through those phases understanding that loss is something that could happen, but it's also like you still have a bit of that anger, but it's that acceptance where it feels like there's a level of peace where you go, okay, this person isn't here anymore. I'm irritated that life can be that way, but I can still move forward without that complete puzzle. And if I had to then go, somebody at home who needs to hear these nuggets, these bits of knowledge, how would I tell them to go? Do they go straight to the clinical psychologist? Is there a way to enter into grief where you know you're going to be going through these phases and you're almost wanting to make sure you do it as well as you can do it? How would you tell somebody to enter into a state of grief?
Okay. You know, the best way to enter into the state of grief is to acknowledge that I'm not in a good space. The reason I emphasize this is because imagine if ever you are grieving and I come to you that, you know what, Fez, you really need to do something. You may listen, you might not. You will actually do something if you have put yourself into the space that I need help. I need to start. And doing that comes with being authentic to yourself, that I'm not doing okay. And a lot of people think it's a sign of weakness. Actually, it is not weakness. We need vulnerability at times. Because I think one author said that, Brené Brown said in one of her books, talking about vulnerability, she said that actually vulnerability is a path to self-awareness. You need to be vulnerable in order for you to reach that step of saying, I need help. The other thing that I find a lot of people battle in terms of being vulnerable, they fear being judged. They fear being judged. Either a person because of their social status, because of their gender, because of how they think they are viewed. They will come up, no, but so and so will think, what will my kids think? What will my wife, my what think if I'm in this space? Therefore, they put up that facade, and living in that facade is quite painful because it's like you are living two different spaces at once. 1 minute you are this person showing up, and the next minute you are
this mask that you have to put on.
Precisely. That's why I emphasize that authenticity, 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 because it opens up. Yes, a person will be vulnerable by then, but as time goes on, like you said earlier, there's always that sweet spot about, you know, being yourself. You'll actually discover that, you know what, I didn't know that I can be this resilient. I didn't know this about myself. So a person needs to do that, allow themselves to go through the pain, allow themselves to even reach that acceptance level that you and I are speaking about. Yes.
I love that because it gives you that holistic idea of like Jungian that's going on. If I had to ask you, where do you find with all these stages, and I say contextually because it's always interesting, I find you find different symptoms and issues depending on where you are. So we're within the KZN landscape in South Africa. Where do people tend to get stuck more often than not, where they find that they're in this? Is it denial? Is it the anger? Is it, where do they find themselves stuck a bit more than, say, other places, and then have to try progress to move to a point of acceptance?
In all fairness, there isn't one particular stage that people get stuck, but I know people don't quickly reach acceptance. You understand? And someone would say, you know, I've accepted when they've lost someone last week, but deep down we know that is a denial. That is, you know, disguising. It's a manifestation of someone else. And you need to probe and find out, walk the person through the journey until they themselves realize that actually I haven't really accepted. Oh my God, I thought I'm there, but I'm still backward. So a lot of people normally, I see them going through this phase of anger. Because guess what? Pain disguises itself as anger. Whenever I am angry deep down, I'm battling deep down, I'm hurt. I normally say to people, when someone sometimes treats you like really badly or is rude, and you see that this person is battling with anger, instead of asking them, what's wrong with you? You are this and this. Rather, are you okay? Do you need help? You'll see it totally different, because all of us are like that. We use the anger in terms of disguising our pain. So I would say, to answer your question, yes, all the stages, but mostly I've seen the anger out there.
Oh, wow.
Yeah.
It's such an interesting space. It really is, because of the nuances you're describing right now,
Yeah.
where I think I've seen people, and of course I kind of see them as patients, or I've seen
Yeah.
people I've interacted with in families, and again, they react differently
Yeah.
to things being lost, something like a limb or
Yeah.
a person. They look like they're okay and they're not, or they become a different person. People are,
Precisely.
you become a lot more angry, or you
Yeah.
become a lot more quiet, and you become. And so for me, I always like to ask, if I'm at home, clearly, and I'm watching this, and you know inside, because that's where we connect these dots,
Yeah.
you feel like this is resonating. I might not have access to you directly because I
Yes.
stay wherever I stay.
Yeah.
What are some of the things that are the resources? What are some of the little kind of community spaces
Yeah.
that I can go to where I can feel like I'm getting poured back into? Church, of course, feels like it might be, because that's where people tend to come together and you can
Yeah.
speak about things per the things you believe. But are there other things you can pull on, be it from a physical standpoint? Is it being physically active? What are some of the things you
Yeah.
could tell people at home
Yeah.
to do?
Since you referred to church, I find that faith-based or spiritually based does a lot in terms of assisting others. Remember, we don't know for sure what happens when someone passes on, but the belief, especially if someone is Christian or whatever religion they are, they believe that, you know what, the person is probably resting, the person is probably an angel, the person is probably in a better space, like we normally say. At least assist someone to reach that level that it's okay, the sense of peace. That's why bargaining comes. Remember, we spoke about bargaining. That's why a lot of individuals would say, hey, the person was really sick. Eh?
Yeah.
They would not have a quality of life like we would think. Yes, we asked and we prayed for healing, but maybe healing is that they don't need to suffer like we saw them going through whatever machines or whatever.
Yeah.
If a person was battling with cancer, through all these treatments, they were very harsh on them. So bargaining comes on that stage. So faith-based also is one of the good coping mechanisms that we normally encourage people that if you do that. But also, a person does not even need to go out and if they, you know, there's so much power in journaling. There is so much power because remember what journaling does for us, we call it expressive writing. What it does, the minute you sit down and you write a letter, every form of thought that we have is normally accompanied by an emotion. All those that you think about, they go somewhere in your mind. Normally we say subconscious mind. They go there, they are packaged there. So when you sit down and you have all these unresolved, all this confusion, they had the pain, and you write it down, you start tearing up, you start breaking up, breaking out, you are crying, that is exactly healthy. Another tip that I can give people out there is that even when you sit down and you get yourself a grief journal, you start writing the letter to the person that you have lost to say, so and so, this is happening. In a way, it assists you even to get a sense of closure.
Oh, yeah.
Gratitude letters, they play a huge role. Because remember, we can be 5 as siblings, we lose a mother. We have unique and different relationships. So if I think I'm my favorite to my mom or I'm this and this, so when I sit down and write, I have that sense of closure because our relationship was personal and it was different. The other thing, connecting with others who probably have gone through the same thing.
Yeah.
Churches do offer, community organizations do offer, if maybe it is widows, widowers, they do offer. There are groups out there where you find that people are experiencing more or less the same. Sometimes it gives you comfort knowing that there's someone who understands what I'm going through. There's someone who will be there to listen when I break down or when I say, no, today I'm here. Because at least you don't feel like you are alone out there. Because remember, one thing about grief as well is that it leaves that sense of anxiety, depending on what role the person played. But a number of times you find that the person gave you the sense of security, the sense of stability. When the person is not here, a lot of us who have lost people, we think, wow, what am I going to do? This person used to do 1, 2, 3, 4, 5 for me. And now I'm in this space where I'm actually feeling alone. So at least finding a group that says, no, we understand. It's going to be okay. You hear them, they've been through that, normally assist a lot.
You've literally pointed out so many different dots that we can connect there. And I think through it all, it's being able to express yourself. I really love those gratitude letters. I think that is something that really allows you to get everything that might have been in there out. Because I think a big key with this is the loss you're describing and the sudden loss, which be it, I mean, in a case where somebody has perhaps lost an arm or an ability to walk, would you still say that they need to be able to express those emotions in that way as well?
Precisely. Exactly the same way. Because they have lost something that was part of who they are. Exactly the same as that. And I think, especially when referring to losing someone through death, remember how, especially us as Africans, how we bury is totally different. It becomes like a huge project. There's a lot of you going there and there and speeches and what and what. A lot of us, we really are present, but we're not present during the whole process. So you really do not get time to sit down and reflect and cry and during that time. So because funerals in any way are supposed to give you that, they literally don't, because of the dynamics involved, because of all these things that are involved when we are burying someone. So having time alone to sit down in your own space and say, I'm saying my goodbyes now. Saying goodbye does not necessarily you're forgetting. It simply is a healing journey.
I love that. Saying goodbye doesn't mean you're forgetting, it's just a healing journey. Doc, thank you so much, Ngiyabonga. You are a wealth of knowledge. Hopefully that has clarified some points to all of you at home. It is mental health awareness. This is an important topic because we all lose something in life, and to be able to have the tools to allow yourself to move through what is a dynamic journey. Clearly, it's not just going through the phases, but moving through them and understanding they can come when they come. Hopefully we've connected a couple more dots. That is another episode of Medshield Movement Connect show in the bag, and I'm hoping you are feeling a little lighter after this one.